Have you ever noticed how certain health concerns seem to feel more frightening simply because we hear their names whispered on the news? One of my patients once looked at me and said, "Doctor, I don't know what scares me more, the illness itself or not understanding what it really means." I want you to imagine this for a moment. A quiet neighborhood, familiar routines, people going about their days, and protection happening gently in the background. Hello, I'm Dr. Evelyn Carter. I'm so glad you're here with me today on Senior Health Daily. Please think of this moment as sitting together in a calm exam room, not rushed, not alarmed, just talking honestly. When we hear the name of a virus, especially something unfamiliar like Nipah virus, it is very natural for the mind to jump to worry. That reaction is human, and it is especially true for older adults who have lived through many health scares over the years. What often gets overlooked is that risk does not always come with noise or urgency. Much of our safety comes from quiet systems and steady people working together. This is what we mean when we talk about Nipah virus risk reduction in communities. It is not about panic. It is about awareness, patience, and trust in the routines that protect us every day. In my years caring for older adults, including those living with memory changes or dementia, I have learned something very important. The brain and body respond best when they feel safe. Clear explanations, familiar routines, and calm reassurance help the nervous system stay steady. Simple science supports this. When stress is lower, the immune system functions more effectively. When understanding replaces fear, people make better choices without feeling overwhelmed. This video is not here to warn you or ask you to change how you live. It is here to help you understand how communities quietly work together to protect health, especially for seniors. In the next part, I will gently explain how these community efforts happen and why they matter for you and those you love. If you find this kind of calm and caring guidance helpful, please take a moment to like this video, share it with someone who may need reassurance, and subscribe to Senior Health Daily. Your support helps us continue creating thoughtful and trustworthy health conversations made just for you. Have you ever noticed how certain health concerns seem to feel more frightening simply because we hear their names whispered on the news? One of my patients once looked at me and said, "Doctor, I don't know what scares me more, the illness itself or not understanding what it really means." I want you to imagine this for a moment. A quiet neighborhood, familiar routines, people going about their days, and protection happening gently in the background. Hello, I'm Dr. Evelyn Carter. I'm so glad you're here with me today on Senior Health Daily. Please think of this moment as sitting together in a calm exam room, not rushed, not alarmed, just talking honestly. When we hear the name of a virus, especially something unfamiliar like Nipah virus, it is very natural for the mind to jump to worry. That reaction is human, and it is especially true for older adults who have lived through many health scares over the years. What often gets overlooked is that risk does not always come with noise or urgency. Much of our safety comes from quiet systems and steady people working together. This is what we mean when we talk about Nipah virus risk reduction in communities. It is not about panic. It is about awareness, patience, and trust in the routines that protect us every day. In my years caring for older adults, including those living with memory changes or dementia, I have learned something very important. The brain and body respond best when they feel safe. Clear explanations, familiar routines, and calm reassurance help the nervous system stay steady. Simple science supports this. When stress is lower, the immune system functions more effectively. When understanding replaces fear, people make better choices without feeling overwhelmed. This video is not here to warn you or ask you to change how you live. It is here to help you understand how communities quietly work together to protect health, especially for seniors. In the next part, I will gently explain how these community efforts happen and why they matter for you and those you love. If you find this kind of calm and caring guidance helpful, please take a moment to like this video, share it with someone who may need reassurance, and subscribe to Senior Health Daily. Your support helps us continue creating thoughtful and trustworthy health conversations made just for you. One of the most comforting truths I have learned over decades of caring for older adults is that much of our protection comes from work we never see. Communities do not wait for fear to arrive before they act. Instead, they watch quietly, patiently, and consistently. This quiet attention is one of the reasons serious health threats are often identified early, long before they affect daily life. Local health systems play a central role in this process. Community clinics, county health departments, and small medical offices collect information every single day. They notice patterns in symptoms, changes in clinic visits, and unusual clusters of illness. Most of the time, these patterns lead to nothing serious at all. But the act of noticing is what matters. It allows communities to respond calmly rather than react suddenly. Family doctors are especially important in this quiet network of care. As a primary care physician, I spent years getting to know not just my patients, but their routines, their families, and even their worries. When something feels different, a trusted doctor often senses it before any formal alert is issued. That relationship becomes a form of early warning, rooted in familiarity rather than alarm. For older adults, this kind of community monitoring is deeply supportive. Seniors often worry that they will be the last to know when something is wrong. In reality, they are often the most protected. Regular checkups, medication reviews, and routine conversations create a steady flow of information between patients and healthcare providers. This flow allows small concerns to be addressed early, without urgency or disruption. There is also a scientific reason this approach works so well. Health systems rely on patterns rather than isolated events. One cough does not signal danger. One fever does not cause alarm. But when professionals quietly compare information across many settings, they can see the bigger picture. This method reduces unnecessary fear while still allowing for thoughtful preparation if needed. I have seen how reassuring it can be for families to know that someone is paying attention even when they are not. This awareness allows older adults to stay focused on what matters most: their routines, their independence, their sense of dignity. Community health monitoring exists to support those priorities, not to interrupt them. So when we talk about communities quietly cutting risk, this is what it looks like. Doctors listening carefully, clinics tracking trends, health departments staying alert without sounding alarms. All of it working together so that seniors can continue living their lives with confidence and peace. When people imagine protection against illness, they often picture dramatic actions or sudden changes. In real life, especially in the care of older adults, protection looks much quieter than that. Community actions against Nipah virus are rarely large or visible. They are built into daily habits and repeated gently over time. This consistency is what truly lowers risk. In many communities, protection begins with simple routines that already exist. Clinics maintain clear hygiene practices. Caregivers wash hands carefully and encourage the same without making it feel urgent. Food handling follows basic safety standards that have been in place for years. These actions do not feel new or frightening. They feel familiar, and familiarity is a powerful form of comfort for seniors. I have watched how older adults respond best to steady patterns. When routines stay the same, the body relaxes. The mind feels grounded. This is especially important for those living with memory loss, where sudden changes can cause confusion or distress. Community efforts work precisely because they disrupt these rhythms. They quietly support them. Education also plays a role, but not in the way many people expect. Community health workers and local clinics share information calmly and only when it is useful. They focus on practical understanding rather than overwhelming detail. This approach respects the dignity of older adults by treating them as capable partners in their own care. There is strong scientific support for this kind of steady approach. Research shows that consistent hygiene and clear communication reduce the spread of many infections. Stress, on the other hand, weakens immune response and affects sleep and memory. When communities choose calm consistency over fear-driven action, they protect both physical and emotional health. I often think of a patient who once told me that what helped her most was knowing that nothing suddenly changed. Her pharmacy remained open. Her doctor's office followed the same routine. Her daily walk stayed part of her life. That sense of continuity allowed her to feel safe even when she heard concerning words in the news. Community actions against Nipah virus work in the same way. They are not loud, they are not dramatic. They are steady, patient, and respectful. By repeating simple protective habits day after day, communities quietly reduce risk while allowing older adults to live with confidence, routine, and dignity. Communities reduce Nipah virus risk not through sudden warnings or strict commands, but through education that feels calm and respectful, hygiene habits that are already part of daily life, and steady cooperation between people and healthcare professionals. This approach works because it fits naturally into routines rather than interrupting them. Education in a healthy community is rarely loud. It happens through gentle conversations at clinics, simple reminders at pharmacies, and trusted guidance from family doctors. I have always believed that education works best when it answers real questions without creating new fears. Older adults often want to know what matters to them personally, not every scientific detail. When information is shared clearly and patiently, it builds confidence instead of anxiety. Hygiene plays a quiet but powerful role. Basic practices such as hand washing, safe food handling, and clean living spaces have protected communities for generations. These habits do not need to be intensified suddenly to be effective. In fact, keeping them consistent is what makes them reliable. Seniors, especially those living with memory changes, benefit from habits that remain the same day after day. Familiar actions help preserve independence and dignity. From a scientific perspective, consistent hygiene reduces exposure to many types of infections, not just Nipah virus. Studies show that simple, repeated behaviors are more effective over time than short bursts of strict rules. When people feel calm, they are more likely to follow these habits naturally. Stress can interfere with memory and judgment, which is why a gentle approach protects both mind and body. Coordination between the community and healthcare systems brings all of this together. Local clinics, hospitals, and public health offices communicate quietly with one another. They share observations, clarify guidance, and adjust recommendations when needed without causing disruption. This cooperation allows responses to remain measured and appropriate. I have seen how reassuring this can be for older adults. Knowing that doctors, nurses, and health workers are connected creates a sense of safety. It reminds people that they are not carrying the responsibility alone. Their role is simply to continue living their lives with care and attention, while professionals handle the larger picture. This partnership is what truly reduces risk. Education builds understanding. Hygiene maintains protection. Coordination ensures balance. Together, they form a steady foundation that allows communities to quietly reduce Nipah virus risk while honoring routine, patience, and the emotional safety that seniors deserve. When we talk about community-based prevention of Nipah virus, I want to be very clear and reassuring. Prevention does not mean asking older adults to suddenly change how they live. In fact, the most effective protection often comes from keeping life steady rather than making abrupt adjustments. Communities succeed when they protect health while honoring routine. Older adults thrive on familiar patterns. Morning rituals, mealtimes, regular walks, and trusted appointments give the brain a sense of order. This sense of order supports memory, mood, and overall well-being. In my experience, caring for seniors, especially those living with early dementia, sudden changes can be far more harmful than helpful. Community-based prevention works precisely because it respects this truth. Most preventive efforts are already woven into daily life. Grocery stores follow long-standing safety practices. Clinics maintain infection control routines they have used for years. Care facilities continue their regular cleaning schedules and health checks. None of this requires seniors to learn something new overnight or to feel that their world has become unpredictable. There is a simple scientific explanation for why this matters. The brain feels safest when patterns remain consistent. When routines are disrupted, stress hormones rise, which can affect sleep, blood pressure, and immune response. For older adults, maintaining familiar habits supports both physical resilience and emotional balance. Prevention that blends into routine allows the body to stay calm and responsive. I often remind families that protection does not come from doing more, but from doing what already works, consistently and thoughtfully. Community-based prevention relies on this consistency. Health workers, caregivers, and local organizations quietly reinforce habits that people already understand. They do not demand sudden behavior changes unless absolutely necessary. This approach also preserves dignity. Seniors are not treated as fragile or incapable. They are respected as individuals who already know how to care for themselves within a supportive environment. The community simply strengthens that environment around them. So when you hear about prevention, I want you to picture continuity, not disruption. Picture communities gently reinforcing familiar routines. Picture older adults continuing their lives with confidence. That is how community-based Nipah virus prevention truly works, quietly reducing risk while protecting comfort, independence, and peace of mind. As we continue together, I want to pause for a moment and acknowledge something very human. When health information is delivered calmly and with care, it allows the body to relax and the mind to stay open. I have seen this again and again in my years of practice. Older adults do not need constant reminders of risk. They need clarity, reassurance, and a sense that they are not alone in understanding what affects their health. Community protection works best when it feels supportive rather than demanding. Seniors are already doing many things right simply by living within steady routines and staying connected to familiar healthcare providers. The community builds on that foundation quietly, without drawing attention to itself. This quiet approach protects emotional safety, which is just as important as physical safety, especially for those living with memory changes or increased sensitivity to stress. I often think about the role of trust in all of this. Trust grows slowly, through consistency and respectful communication. When people trust their doctors, their clinics, and their local health systems, they feel less pressure to constantly monitor every headline or worry about every new word they hear. That trust allows them to focus on what truly supports well-being, such as rest, connection, and daily structure. It is also important to remember that learning does not have to feel heavy. Education can be gentle. It can arrive through conversation rather than instruction. That is why I believe so strongly in sharing health information in a way that feels personal and grounded. When people feel understood, they are more likely to absorb what matters and let go of what does not. I want to take a brief moment here to speak to you directly, just as I would if you were sitting across from me in my office. I'm Dr. Evelyn Carter from Senior Health Daily. If this video has helped you better understand your health, please consider subscribing, liking, and sharing Senior Health Daily. Your support truly encourages us to continue creating calm, helpful, and trustworthy health content made especially for you. Your presence here matters. It tells me that you care about your health and about staying informed in a way that protects your peace of mind. This shared space is built on patience, dignity, and mutual respect. Together, we can keep these conversations calm and meaningful, allowing knowledge to serve as reassurance rather than pressure. When we talk about the public health response to Nipah virus, I want you to picture it through the eyes of a caregiver who has spent years protecting older adults from unnecessary worry. The goal of public health is not to place responsibility on seniors or families. Its purpose is to carry that responsibility quietly, so daily life can continue with as little disruption as possible. Public health systems are designed to work in layers. Many professionals are involved, often without being seen. Epidemiologists review data. Local health departments communicate with clinics. Hospitals review preparedness plans. All of this happens whether or not there is an immediate concern. For older adults, this means there is a safety net already in place before any personal action is ever required. From my caregiving perspective, This is one of the most compassionate aspects of modern healthcare. Seniors should not have to track every new virus or evaluate every piece of information they hear. That kind of constant alertness is exhausting and can affect sleep, memory, and emotional balance. Public health systems exist so older adults do not have to carry that burden themselves. There is also a strong scientific reason this approach works. Coordinated systems are more effective than individual reactions. When health professionals share information calmly and adjust responses thoughtfully, they prevent overreaction and confusion. This protects the nervous system of the community as a whole. For seniors, a calm environment supports better immune function and cognitive stability. I have spoken with many caregivers who feel relief knowing that guidance comes from trained professionals rather than social media or rumor. Clear recommendations are shared only when necessary and in ways that prioritize safety without fear. This measured response is intentional. It protects dignity by allowing older adults to feel respected rather than managed. Another important role of public health is continuity. Even during periods of monitoring or adjustment, essential services remain stable. Clinics stay open. Medications remain accessible. Regular appointments continue. This continuity is especially important for those living with dementia or chronic conditions, where consistency supports orientation and comfort. So when you hear that public health systems are responding to something like Nipah virus, I want you to hear reassurance rather than alarm. It means professionals are doing their work quietly and carefully. It means layers of protection are already functioning. And most importantly, it means you are not expected to change your life or live in worry. This is what thoughtful caregiving looks like at a community level. It is protection that allows older adults to focus on living, resting, and maintaining routines that support health and dignity. When we talk about Nipah virus and seniors, the most important thing I want you to understand is that emotional stability matters just as much as physical protection. Older adults do not benefit from a constant flow of new information. In fact, too much information can quietly undermine health by increasing stress, confusion, and fatigue. As we age, the brain processes information differently. It takes longer to sort what is relevant from what is not. For seniors living with memory changes or early dementia, this becomes even more true. Repeated exposure to alarming headlines or rapidly changing details can feel disorienting. I have seen patients who were physically well but emotionally unsettled simply because they felt surrounded by noise they could not make sense of. From a caregiving perspective, stability is protective. Familiar routines help anchor the mind. Regular sleep schedules, predictable meals, and trusted medical relationships support emotional balance. When these foundations are steady, the body responds better to everyday challenges. Stress hormones stay lower. Sleep is deeper. The immune system functions more effectively. Simple science confirms this connection between calm and resilience. This is why communities and health systems are careful about how information is shared with seniors. Not every update needs to reach every individual. Professionals filter what matters and when it matters. This protects older adults from carrying a burden they were never meant to hold. Seniors should not feel responsible for tracking every possible risk. Their role is to live well within the routines that already support their health. I often tell families that reassurance does not come from knowing everything. It comes from knowing that someone else is watching carefully on your behalf. When older adults trust that their doctors and communities are attentive, they can step back from constant concern. That trust restores a sense of safety, which is essential for dignity and peace of mind. There is also a deeply human element to this. Many seniors have lived through decades of change. They have adapted again and again. What they need now is not urgency, but respect for the pace that allows them to feel grounded. Flooding them with information can feel like being pushed rather than supported. So when we speak about Nipah virus in relation to seniors, the focus should always return to stability, calm explanations, consistent routines, trusted voices. These protect mental health, preserve memory, and support overall well-being. By prioritizing emotional steadiness over information overload, communities quietly safeguard what matters most for older adults. Protecting older adults from viral infections is rarely about one single action. It is about the gentle strength of community, the steady presence of family, and the comfort of familiar daily rhythms. When these elements work together, protection becomes part of life, rather than something added on top of it. Community plays a quiet but powerful role. Neighbors check in on one another. Local clinics remain accessible and consistent. Pharmacies recognize familiar faces and notice when something feels off. These small moments of connection create a network of care that often goes unnoticed, yet it surrounds older adults with support. This kind of protection does not require vigilance from the senior. It exists so they do not have to worry. Family adds another important layer. Loved ones help maintain routines rather than disrupt them. They remind without pressuring. They offer assistance without taking away independence. In my experience, older adults feel safest when family support feels natural and respectful. Protection works best when it preserves dignity and choice. The rhythm of daily life is just as important. Regular meals, familiar environments, and predictable schedules give the body cues of safety. For seniors, especially those living with memory changes, routine supports orientation and reduces stress. Lower stress supports immune health. This connection is well established. When the nervous system feels calm, the body is better able to respond to everyday challenges, including infections. I have cared for many older adults who stayed remarkably resilient simply because their lives remained steady. They slept at the same time each night. They continued their walks. They kept their appointments. Their world felt understandable. That sense of understanding protected them in ways that fear never could. Communities that protect seniors understand this balance. They do not isolate older adults from life. They help life remain predictable and supportive. Health guidance is woven into existing habits. Families and caregivers reinforce what already feels safe. So when we talk about protecting older adults from viral infections, we are really talking about preserving connection, community connection, family connection, connection to routine. These are the foundations of health in later life. By honoring them, communities quietly reduce risk while allowing seniors to continue living with confidence, comfort, and dignity. As we bring these thoughts together, I want to return to the heart of this conversation. Nipah virus risk reduction in communities is not a story of urgency or fear. It is a story of patience, coordination, and trust, unfolding quietly over time. When those elements are present, protection becomes steady and dependable, especially for older adults who need calm more than constant updates. Patience shows up in the way communities choose consistency over sudden change. Health systems observe carefully rather than reacting loudly. Families support routines instead of disrupting them. Seniors are given space to live their lives without feeling pressured to monitor every headline. This patience protects emotional balance, which in turn supports memory, sleep, and immune health. In my years of caregiving, I have seen how powerful it is when people are allowed to move at a pace that feels safe. Coordination is the second pillar. Clinics, doctors, caregivers, and public health professionals share information quietly and thoughtfully. Each group knows its role. No one expects older adults to carry the burden of decision-making alone. This coordination allows guidance to be clear and measured when it is truly needed. It prevents confusion and protects dignity by ensuring that responses feel supportive rather than controlling. Trust ties everything together. Trust grows when systems are reliable and communication is respectful. When seniors trust their doctors and their communities, they can let go of constant worry. That release matters. Chronic worry can affect blood pressure, digestion, and cognitive clarity. Trust restores a sense of safety, and safety is essential for healthy aging. I often remind families that protection does not always announce itself. When things are working well, life feels ordinary. Appointments continue. Meals are shared. Routines remain intact. That ordinary feeling is not an accident. It is the result of many people working together behind the scenes. This is why Nipah virus risk reduction in communities feels quiet. It is designed that way. It allows older adults to focus on living rather than preparing for danger. It respects the need for emotional steadiness and honors the wisdom that comes with age. As a doctor who has walked alongside seniors and their families for many years, I believe deeply in this approach. Health should support life, not interrupt it. When patience, coordination, and trust guide our response, communities become places of reassurance rather than fear. That is the message I hope stays with you. Protection can be calm, care can be quiet. And when communities work together with intention and respect, they create a foundation where older adults can continue living with confidence, routine, and dignity. As we come to the end of our time together, I want to thank you for staying with me and listening so thoughtfully. Simply listening and understanding is already enough. You do not need to change anything right now. You do not need to carry extra worry with you when this video ends. What matters most is that you feel steady and supported. Throughout this conversation, we have talked about patience, trust, and the quiet strength of community. I want to remind you that your body has carried you through many seasons of life. It knows how to find balance when it is given calm, routine, and kindness. When information is shared with respect and without urgency, it becomes a form of support rather than a burden. That is how knowledge should feel. Communities exist to protect, especially to protect older adults who deserve peace and dignity. Much of that protection happens quietly, without asking anything of you. Doctors, caregivers, and health systems are doing their work so you can continue living your life with confidence. You are not expected to stay alert or on guard. You are allowed to rest in the trust that care is already in place. I hope you leave this video feeling understood and reassured. Gratitude for your body, patience with your pace, and trust in the systems around you can be powerful companions. They help create emotional safety, which supports memory, sleep, and overall well-being. If there are moments when health information feels overwhelming, remember that you can always return here. Senior Health Daily is a place for clear explanations, gentle conversations, and compassion that moves at your speed. If this time together brought you comfort or clarity, I invite you to follow Senior Health Daily and stay connected. We are here to walk with you, calmly and respectfully, whenever you need reassurance.